Namaste, I am Dr. Neha Gupta. I am a senior consultant in the Department of Obstetrics and Gynecology at Medanta Gurugram. So, cervical cancer is cancer of the cervix, the lowermost portion of the uterus. Uterus means the womb. So, the lowermost portion of the uterus or the mouth of the uterus is called cervix, and cancer of this portion, cancer of cervix, is called the cervical cancer. Now, why does cervical cancer happen? So, there are various causes of it, but the most important cause of cervical cancer is infection with a virus called the HPV virus or the human papilloma virus. This is a virus which is sexually transmitted, and so if somebody is having multiple sexual partners, somebody is having early age at the time of first sexual intercourse. Along with this, if there are other reasons of reduced immunity such as smoking, such as low nutrition, lower socioeconomic status, then these are all the contributory factors which can lead to cervical cancer. So when do we suspect that there could be something wrong? So there are some red flag symptoms. One of the most important is bleeding after intercourse. That is called as postcoital bleeding. The other signs can be having excessive vaginal discharge. This discharge can be foul smelling, it can be blood stained. The other thing can be irregular periods. There could be irregular bleeding, heavy bleeding during the regular periods, that is intermenstrual bleeding. All of these can be suggestive that there is something wrong, and if any of these is happening, you must go and get yourself examined by a gynecologist. Now, cervical cancer does not develop overnight. Once the sexual activity happens, almost all women get infected with the HPV virus. But the good thing is that the body has a defense mechanism and it starts clearing out the virus. Most women will clear out this virus by the age of 30 years. But if in some lady there is a persistent infection with the high risk type of HPV virus, then the virus will continue to stay in the cervix and it will lead to various stages of abnormality, passing through minimal abnormality to mild abnormality, moderate abnormality, then severe abnormality, and then frank cancer. So like I said, the process takes several years to happen. The progression from mild stage to the very severe or invasive stage can take as many as 15 years. And that gives us the very important window of opportunity where women can actually regularly keep visiting the health facility and get their pap smears done, so that even if there is any abnormality in the very early stages, it can be picked up and it can be completely cured. We have, I think, already talked about the risk factors for cervical cancer. So generally the cancer of the cervix has a bimodal age distribution. There can be increased number of cases seen in the third decade of life, and then again there can be increased number of cases seen in the fifth decade of life. But like I said, anybody who is not practicing safe sex, having multiple partners, not using the protection, and having very early age at the time of first intercourse, having reduced immunities, people who are infected with HIV or other sexually transmitted infections are at increased risk. Also smokers and people with lower socioeconomic status and people with poor nutrition are the ones who are more likely to get this cancer. So cervical cancer, if we suspect that there is something wrong, the first thing is that once you go to the doctor, she is going to examine you physically. So we have a look at the cervix, and either we can see a frank growth in the cervix. The growth can be very fragile, it can be like a cauliflower, and that would mean that it is grossly abnormal. Sometimes we may not see any frank growth, but we may just find little bit of abnormality in the cervix. So at that stage we do take a pap smear. The pap smear may show cancerous cells. If it does not show and we are still suspicious, then the best way forward is to take a cervical biopsy, and biopsy is 100% confirmatory. of a cancer. For any other cancer, the treatment and the outcome is largely going to depend upon the stage at which it is diagnosed. If we have diagnosed the cancer very, very early and it is still not spread beyond the cervix, then it is very much curable. There are various treatment modalities, being surgery, chemotherapy and radiation therapy. A cancer which is in the early stage and can be operated undergoes a surgery and then may later on need adjuvant chemotherapy or radiotherapy. But if the cancer is already advanced at the time when it is diagnosed, then before surgery chemoradiation is done to reduce the size of the disease, and then a surgery is performed.